The room went dead silent when she moved. Nobody noticed. That was the thing about Laura Bennett, she perfected the art of being invisible while making people alive. 3:47 in the morning, Seattle General's ICU ward, Norfolk section. Commander Michael Hayes lay in bed 7 with a chest wound that refused to heal, skin the color of old concrete, his wife asleep in the vinyl chair beside him with her hand still gripping his. Laura adjusted the ventilator settings without disturbing either of them. 1.2 liters. The hiss of air escaping sounded like sand through an hourglass. She checked the central line next. 14 gauge, placed flush, no signs of infection or migration. Her hands moved with the kind of precision that looked casual to anyone watching, but that was because they'd held far worse than 4 lines. They'd held intestines. They'd held a man's beating heart in a schoolhouse basement while mortar rounds walked across the roof like God was tapping his fingers. She didn't think about that anymore. Not while she was working. Bennett. The voice came from behind her, Dr. Raymond Mercer, the cardiothoracic attending, his white coat pristine enough to see his reflection in. He was studying her with the expression of a man watching an ant build something impressive. "How long have you been standing there?" She turned. "Steady. Unremarkable. Just a nurse checking vitals. 7 minutes. BP stable. O2 sat 92%. No arrhythmias since the last adjustment. I didn't ask for a status report." He stepped closer, positioned himself so he was looking down at her notes. 6'2", maybe 220. The kind of build that came from a good genetic lottery ticket and enough money to maintain it. "I asked how long you'd been standing there." 7 minutes, doctor." His eyes moved from the monitor to her hands. "Scarred. Not the clean surgical scars of someone who'd spent their career in operating rooms. These were rough, a slice that ran from her thumb to her wrist, another one just below her eye that she'd never bothered to get properly closed, burns on her palms that had healed into white-brown patches. He was looking at her like he was solving an equation that didn't make sense. "You have a particular way with him," Mercer said. It wasn't a compliment. His voice had the texture of expensive leather, smooth but cold. "Families ask for you by name, I've noticed. They see you in the hallway and their vital signs improve. It's almost like you're performing miracles." Laura didn't respond. Silence was safer. She finished her chart notation, 03 for 7 hours, vital stable, no acute changes, wound dressing clean, patient sedated, and prepared to move to the next room. That's remarkable for someone with an associate's degree. Mercer was still watching her. "How long have you been a nurse, Bennett?" 12 years. 12 years of what, exactly? Bed baths and bedpans. He laughed. Thin. Cutting. The kind of laugh that was designed to make you feel small. "Because I've been doing this for 19 years, residency, fellowship, research publications, and I still don't understand how you manage to stabilize patients that I've spent hours trying to save. It's almost like you know something I don't." The monitor beeped once. Normal sinus rhythm. Laura's jaw tightened fractionally. That was all he got, that one small flex of muscle. Nothing in her face. Nothing in her eyes. She'd been trained to survive worse than this. Commander Hayes's wife shifted in the chair, her head tilting against the armrest. She'd been sitting there for 36 hours straight. Laura made a mental note to bring her a pillow that didn't come from the hospital supply closet. Those things were designed by people who'd never actually tried to sleep in them. She'd bring the good one from the break room instead, the one with the pillowcase that didn't smell like industrial washing machines. "I read your file when you applied," Mercer continued, and now he was pacing. "Small steps. Predatory. No military background. No advanced training. No specializations. Just a hospital certificate program and 12 years of showing up. And yet somehow you're exceptional." He turned back to face her. "How does that happen, do you think? How does someone with your background become so indispensable?" Laura kept her voice level. Professional. I pay attention, doctor. The patients do the rest. Pay attention. He repeated it like she'd said something naive. You know, I had a patient last month, similar presentation to the commander here. Septic shock from what should have been a routine wound. I was managing his antibiotics, his fluids, his pressors. All the things that keep people alive. And he's still arrested. Died right in front of me, despite everything I did. He paused. Let the silence sit. Do you ever lose patients, Bennett? Or does your special attention rate keep them alive like you're performing some kind of magic? The monitor continued its rhythm. Beep. 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 Laura's hands were still. Her breathing was still. She was made of still. I do my job, she said. That's what I'm afraid of. Mercer moved toward the door, stopped with his hand on the frame. You know what I think? I think you're someone who doesn't belong here. Someone pretending to be something you're not. And eventually, people figure that out. Eventually, the facade cracks. He smiled. Not a warm expression. Something with teeth. I'm just going to help the process along a little bit faster. He left. The door hissed shut behind him. The ventilator wheezed its mechanical rhythm, and Laura stood in the fluorescent-lit silence, her hand still steady, still precise. Around her neck, hidden beneath her scrubs, was a dog tag that didn't match her identity. In her locker downstairs was a folded flag from a teammate who died in Kandahar. In her apartment was a locked box containing a silver star and a citation that the Pentagon had officially declared never existed. She turned back to Commander Hayes. His eyes were still closed, still sedated, and he had no idea that the woman checking his monitors was the one they used to call in Ramadi when the field hospital got hit. Malak al-Sawa. The angel of the desert. The one who'd patched up Marines with supplies that didn't exist and hands that worked like she had a direct line to God himself. He'd been there that night. She remembered his face from the briefing photos, a young lieutenant then, running a squad through the Jolan district. She'd never met him, not in person. But she'd heard about him later, the Marine whose unit had protected the schoolhouse where she'd worked, kept the insurgents far enough back that she could keep people breathing. But that was Captain Laura Bennett. That woman was classified. That woman had been redacted from every official record by an order that came down from the Pentagon with a single instruction: disappear. Take a new name. Take a new life. Never surface again. The operation had gone sideways, someone high up had decided it was better if she didn't exist, and so she didn't. Not officially. She checked Hayes's medication drip, propofol and midazolam, standard dosing for ICU sedation. Everything correct. Everything safe. Exactly what a competent nurse would provide. She just happened to be something else underneath. What happened next, over the next few days, would teach Dr. Mercer that you never actually know the person standing next to you. Never. You think you understand their credentials, their limitations, their position in the hierarchy. You think you know how much of a threat they can be. But the ones who've been shaped by something darker, something harder, something that exists outside the normal world, those people are capable of things that make a medical degree look like a participation trophy. Laura moved to the next room, her limp barely noticeable. Just a quirk. Just a sign of someone who'd spent too long on her feet. She didn't know yet that Mercer had already started making calls. She didn't know that his contempt had tipped over into something operational, strategic, designed to push her out systematically before she could threaten his position any further. She didn't know that within 48 hours, her name would appear on incident reports that never happened, that her competence would be weaponized against her, that her calmness would be mistaken for guilt. But she would find out. And when she did, that's when the real nightmare would begin. Dr. Mercer waited until the shift changed, until the corridors were busy enough that Laura's humiliation would have an audience. He stood in the doorway of Commander Hayes's room, clipboard in hand, his face arranged in an expression of grave concern that didn't reach his eyes. Laura was adjusting the central line, her movements economical and sure, her hand steady as she checked the dressing for any sign of infection. "Mrs. Hayes," Mercer said, his voice carrying that particular timbre of manufactured distress. "Mr. and Mrs. Hayes, I need to address a serious concern about your son's care." The commander's mother looked up from her chair. His father straightened. Mrs. Hayes, who'd been holding her husband's hand, released it slowly. Mercer stepped fully into the room, positioning himself so that the doorway framed him like a stage. "This central line was contaminated during placement," he announced, gesturing toward Laura with the kind of theatrical precision that made every word land like an accusation. "That's unacceptable. Dangerous, actually." Laura's jaw tightened fractionally. She didn't pause in her work. Her hands continued their steady rhythm, checking connections, verifying the line flow, noting vitals on the chart. Her face remained a professional mask, the kind nurses perfected over years of absorbing blame that wasn't theirs. "The line is clean, doctor," she said quietly, still facing the equipment. "I followed protocol exactly." Mercer laughed, a small, pitying sound. "You followed what you think is protocol. That's precisely the problem." He turned to face the Hayes family directly, his voice dropping into that register of false concern. "Ms. Bennett here has excellent bedside manner, I'll grant her that. Patients find her comforting. But comfort isn't a substitute for credentials, is it? She doesn't have the advanced training to understand the nuances of line placement in post-operative care. What you're seeing is dangerous incompetence from someone working well beyond her actual qualifications." The commander's mother gasped softly. Her hand moved to her mouth. Laura turned to face Mercer. She stood with her back straight, her hands at her sides, her eyes meeting his for exactly 2 seconds before looking past him. Not through fear. Through discipline. Through the kind of restraint that came from knowing exactly what happened to people who lost their composure in front of authority figures. Mercer continued, his voice taking on that particular cadence of a man performing concern for an audience. "How many patients have you cared for, Ms. Bennett? And of those, how many experienced unexpected complications? I'm not suggesting negligence, of course. I'm suggesting limitations. We all have them. The question is whether you're operating within yours." 5 minutes. He catalogued her shortcomings for 5 minutes, her lack of advanced credentials, her pattern of being present during complications, his concern about her judgment in high-pressure situations. He never raised his voice. That was the artistry of it. His tone remained conversational, concerned, the voice of a physician genuinely worried about patient safety. Laura didn't respond. She stood silent, her face a mask that revealed nothing except the slight whitening of her knuckles where her hands had curled into fists at her sides. That was all. A small detail. A micro-expression of restraint so controlled that only someone looking for it would have seen the trembling wasn't fear. It was restraint. Mercer left the room satisfied. He'd planted the seed. Mrs. Hayes was pale. The commander's father had his arm around his wife. And every nurse who'd been in the hallway, who'd paused near the doorway and heard the exchange, now carried a narrative forward, one that Mercer had carefully constructed, word by word. The next morning, Laura entered the break room with her lunch. The conversation died mid-word. 3 nurses at the center table suddenly remembered urgent errands elsewhere. A resident glanced up, saw her, and quickly looked back at his phone. She set her lunch in the refrigerator, the sound of the door closing echoing in the sudden silence, and sat at the far table, alone. This was how it worked. Not with overt hostility. With subtraction. With the slow removal of the casual companionship that made hospital shifts bearable. With the invisible wall that appeared when she walked in. Over the next 4 days, the pattern solidified. Conversations would be happening, genuine, collegial exchanges about cases and weekend plans, and would halt entirely when she approached. Staff would find themselves needing to check on something in another unit, suddenly remembering a supply order that couldn't wait, noticing an urgent page that required their immediate attention elsewhere. Mercer had been busy in the interim. Quiet conversations in hallways. A mention to the attending physician about Laura's concerning pattern during the Hayes admission. A casual comment to the charge nurse about a medication timing that was close but not quite right on a routine for antibiotic. Seeds planted carefully, each one designed to make the soil more hostile. By Thursday morning, everyone knew. The message had spread through Seattle General like infection through an open wound, carried on whispers and knowing glances, reinforced by the calculated absence of her colleagues. Laura arrived for her shift and checked the unit disciplinary board as she always did, a simple procedure, something every staff member glanced at to see if there were any schedule changes or safety alerts. Her name was there. In red marker. Standing out like a wound. Protocol violation, final warning, Elv Bennett. Medication timing discrepancy, Commander Hayes, 0400 hours. The medication timing discrepancy had never happened. She'd verified the antibiotic infusion at 03 for 7 hours and documented it correctly. But Mercer's falsified notes placed the administration at 0 for 05 hours, 5 minutes late, a trivial variance that in his handwriting became evidence of carelessness. 7 staff members were in the hallway reading it when she approached. Their eyes shifted away when she stopped in front of the board. She read the entry with no visible reaction. Her jaw didn't clench. Her breathing didn't change. She simply read the words, absorbed them, and turned to her assignment sheet as if nothing had happened. That night, alone in her kitchen with the lights off and rain hammering the windows like applause, she gripped the folded flag from her fallen teammate until her knuckles went white. The fabric was worn soft from years of being held exactly like this, during the worst moments, when composure finally had permission to fail. But that wasn't the worst part. The worst part was day 6, when Commander Hayes's infection didn't follow the script Mercer had written for him. The worst part was when routine became catastrophic, when a simple dressing change revealed what happens when a body's own immune system turns on the surgical site like a mutiny. Laura was alone with the commander when it started. His wife had stepped out for coffee. The hospital corridor outside was busy with the usual Thursday rhythm, monitors beeping, pages paging, the ventilator in room for cycling its mechanical breath. Laura was changing the dressing on Hayes's chest wound, a procedure she'd done 17 times in the past 5 days, watching the surgical site heal incrementally. This time when she peeled back the dressing, something was wrong. The surgical site was erupting. Not the slow, manageable inflammation of healing. This was necrotizing fasciitis accelerating at a pace that meant infection had already hit the tissue planes, was already moving toward the mediastinum where the heart lived. Hayes's vitals confirmed it. Heart rate spiking. Blood pressure dropping. Temperature reading 104.2 degrees Fahrenheit. Laura didn't hesitate. She hit the code button and reached for the phone simultaneously. Code blue, ICU room 7. Code blue. The responding team arrived within 90 seconds, a resident, 2 nurses, an anesthesiologist. But 90 seconds was 90 seconds too long. Hayes's heart rate was climbing toward 180. His blood pressure was collapsing. His oxygen saturation was falling as his lungs filled with the body's panic response to septic shock. "We need the surgical team," the resident was saying, her voice climbing. "We wait for." "He'll be dead before they get here," Laura interrupted, already moving. She didn't shout. She didn't sound panicked. Her voice had simply dropped into a register that carried the weight of absolute certainty. "Thoracotomy tray. Now. Get me a scalpel kit." The resident froze. "That's not a nursing procedure. We need." But Laura was already moving, and her hands were already moving, and something in the way she was moving made the entire room understand that this was not a discussion. This was a command. This was someone who'd given orders before. Who'd received them. Who understood the mathematics of survival in ways that nursing school had never taught. Dr. Mercer arrived just as the thoracotomy tray came through the door. He took in the scene, Hayes crashing, Laura positioning herself for a procedure that didn't exist in her job description, the team scrambling around her like she was a gravity well pulling them into an orbit of her making. Bennett, step back, Mercer said, his voice sharp. We wait for surgical. But Hayes was coding. His heart was failing. The infection had breached the pleural space and was moving toward the myocardium like a siege weapon, and there was no waiting, no protocol, no chain of command that meant anything when the man on the table was about to die. Laura cracked his chest with movements that had nothing to do with nursing school. With movements learned in a Ramadi schoolhouse where the generators were failing and the mortar rounds were landing outside and there was no one else. With movements that came from muscle memory older and deeper than her civilian identity. The rib retractor clicked open. The sterile field blazed under the surgical lights. Her fingers found the source of the infection, a bleeder from the surgical site that had gone septic, and she clamped it, maintaining pressure with a hand steady as a surgical laser. The actual trauma surgeon arrived seconds later, took one look at what Laura had done, and took over the procedure. But the bleeding was controlled. The infection was contained. The clock that had been counting down toward cardiac arrest had been reset. Hayes's heart rhythm stabilized. His oxygen saturation climbed. His blood pressure returned to the range of living. And Dr. Mercer stood in the corner of the room, his face white, not with relief, but with something else entirely. With the particular rage of a man watching his narrative collapse in real time. With the fury of someone who'd been shown up, made irrelevant, reminded that authority and credentials and years of accumulated position meant nothing when the person next to you could do something he could not. His hands were shaking as he reached for his phone. Day 6 arrived like every other day, fluorescent lights humming their mechanical prayer, the antiseptic smell of bleach and hope hanging in the ICU corridor. Laura moved through her shift with the precision of someone who'd learned long ago that her hands were more honest than her voice. The disciplinary board warning sat in her personnel file in red marker, typed words that meant nothing, carried the weight of everything. She changed Commander Hayes's for bags with the same careful attention she'd given them on day 1, her movements economical, her breathing steady, her jaw a line of controlled pressure. The command she'd received was clear: one more mistake and they'd have grounds. One more incident and the investigation would close with her name at the bottom. Mercer had woven his poison so thoroughly through the hospital corridors that even Dr. Chen from pulmonology now avoided her eyes during rounds. The isolation was complete. It was also irrelevant. Laura had survived things that would have broken most people into manageable pieces. She had held pressure on arterial bleeds with the same hands that now pressed medication into lines, and the emotional distance required to do both came from muscle memory developed in places this hospital would never acknowledge. Commander Hayes was responding well. His sepsis markers were dropping, his oxygen saturation climbing back toward normal. He'd made it through the worst of the infection's assault on his system, and the antibiotics were doing their work with the steady competence of science. Laura noted the improvement on his chart at 2:53 p.m., her documentation precise and professional, exactly the kind of work that couldn't be faulted because it was beyond fault. Every notation perfect. Every decision defensible. Every action by the book, even as the book itself was being rewritten against her. The code alarm came at 3:14 p.m. Not the gentle escalation of a monitor alert. The full system shriek that means cardiac arrest, that means time stops mattering because there is no time left, only the next 30 seconds and what you do inside them. Laura was 3 rooms down when she heard it, and her body knew before her brain caught up. The alarm was Hayes's room. The trajectory of her walking had already changed, her pace already accelerating to something beyond hurry but not yet panic. Other nurses converged. A resident appeared from the break room. The charge nurse was calling the code, her voice cutting through the noise with the institutional precision that meant the machinery was starting, the machines and the protocols and the systematic attempt to reverse something that wanted very badly to be irreversible. She pushed through the doorway and saw it instantly. Commander Hayes's chest wound had opened. Not slightly. Completely. The surgical line had separated, tissue edges gaping like a mouth, and beneath the opened wound something dark and wrong was spreading through his chest cavity. Necrotizing fasciitis. The infection had moved faster than the antibiotics could contain it, had hit his heart like artillery, and his rhythm on the monitor was the chaos of a system in collapse. Blood. The smell of copper and opened flesh and the particular scent of a body's defenses failing. His wife was screaming. A nurse was bagging him, pushing oxygen into lungs that weren't processing anymore. The resident froze. Laura watched it happen, the moment when training becomes irrelevant and the gap between knowledge and action becomes too wide to cross. His mouth opened. Nothing came out. The senior resident was calling for a crash cart, for the attending, for someone with the authority to make the decision that needed making right now. Laura moved toward the instrument tray. Her voice came out low and steady, not loud but cutting through the noise like a blade through water. Thoracotomy tray. Now. Not a request. Not a question. A statement of fact delivered in a tone that made the circulating nurse move without thinking, without questioning, without needing the attending's permission or the resident's agreement. Her hands were already moving, gloves snapping on, sterile field opening, the tools of her other life suddenly appearing in her hands as if she'd never left that place, as if 6 years of nursing scrubs hadn't replaced combat fatigues and the smell of hospitals had somehow always been the smell of the field hospital in Ramadi where she'd learned to hold people together with nothing but skill and necessity. Muscle memory took over. That was the phrase people used, and it was accurate, but it was also incomplete. It wasn't memory doing this. It was something deeper, the knowledge embedded not in her mind but in her hands, in her shoulders, in the precise angle of approach that came from having done this before under circumstances that would have justified doing nothing at all. She steadied herself at Hayes's bedside. The tray was being positioned. She didn't wait for authorization from anyone. The scalpel felt like coming home. The incision through the chest wall was fast and definitive, committed in a way that surgery sometimes wasn't, because hesitation meant failure and failure meant death, and she had already decided 1 minute ago that neither of those things was acceptable. The ribs opened. Her fingers moved through the exposed cavity with the terrifying fluid precision of someone who understood anatomy not from textbooks but from repetition under fire. There, the hemorrhage was coming from a branch of the pulmonary artery, the infection had eroded through the vessel wall, and the bleeding was the final thing that would kill him if she didn't stop it in the next 40 seconds. Her hand was already moving for the clamp, the satin sky clamp, and her voice was giving orders to the code team that moved around her like she was the gravity well and they were simply orbiting her trajectory. The bleeder came under control. The oozing was slowing. Hayes's blood pressure, which had been a ghost of a number on the monitor, began to climb. 70. 80. Climbing. The attending burst through the doors at the moment everything shifted from chaos to control. She didn't acknowledge him. She was closing the sternum, her movements economical and absolutely certain, and the room around her had changed. Everyone was working now, working because something had shifted in the air, because the person at the center of this crisis had stopped being uncertain and started being the only person in the room who knew what the next 10 minutes required. The attending's mouth was open. The senior resident was staring. The circulating nurse was handing instruments before they were asked for, moving in sync with someone she was watching for the first time but had somehow already learned to trust. Hayes's rhythm stabilized. The monitor's beeping found a pattern, found sinus rhythm, found the sound of a heart that had decided not to quit. Oxygen saturation climbed toward the place where lungs worked and brain survived and people didn't die from infections that wanted to turn them inside out. Laura finished the final suture and stepped back, her hands coming away blooded but her breathing completely steady, her pulse unhurried, her face the blank professional mask that had been perfected in places she legally couldn't talk about. That was when she saw Mercer's face. He was standing at the doorway of the observation window, and for exactly 3 seconds the emotion that crossed his face was so raw and unguarded that it would have been impossible to misinterpret. Not shock. Not confusion. Rage. Pure, crystalline, humiliated rage. He'd spent months building toward this moment, months constructing the narrative that would remove her, and he'd just watched her save a Marine's life with the kind of precision and composure that his years of fellowship and publication credits and position meant he could never match. He could study the technique. He could practice the movements. But he could never do what she'd just done because he would still be thinking about it while she was already moving. He would still be processing the fear while her hands were already solving the problem. His face was a color somewhere between white and purple. He disappeared from the window immediately, moving with the jerky, disconnected quality of someone operating on pure reflex instead of thought. Laura turned back to Hayes, to the work of stabilization that came after the crisis, to the methodical documentation that followed emergency procedures. But she already knew what was coming. She'd seen that expression before. She'd seen it on the faces of people about to do something desperate because desperation was all that was left. Mercer had a strategy that had failed. Now he would move to the only thing remaining. He would burn the entire system down rather than accept that he'd been wrong about her. By 4:07 p.m., he was in the administration office. By 4:52 p.m., the incident reports had been filed. By 5:22 p.m., Laura was being called to see the director. The walk down the hallway felt like moving through water that had gotten thicker and colder with each step. She could feel the eyes on her from the nursing stations, the conversations that stopped mid-word, the careful neutrality of people who had already learned which way the wind was blowing and had decided to stand somewhere safer. Mercer was outside the director's office when she arrived, leaning against the wall with his arms crossed, holding a folder that was easily 3 inches thick. The expression on his face wasn't rage anymore. It was satisfaction. The folder contained incident reports citing her for practicing beyond her scope. Reports accusing her of performing unauthorized surgical procedures. Reports claiming she'd endangered patient welfare through reckless action. Each form was filled out with the precision of someone who understood how to weaponize bureaucracy, how to cite regulations and invoke standards and build a structure that looked unassailable because it had been assembled by someone who understood institutional power. Regulation 47B, subsection 12 regarding emergency authorization protocols. Joint Commission Standard MS 43. It was all there. It was all correct. It was all completely defensible and utterly damning. The director couldn't meet her eyes. His position was predetermined, his hands tied by the specificity of the allegations, his options narrowed to a single path. Effective immediately. Pending investigation. She would need to surrender her credentials, her badge, her access. Security would escort her from the building. The investigation would take 45 days, and pending the outcome, she could apply for reinstatement, though the director's tone suggested everyone in the room understood that reinstatement was a formality for a process that had already concluded. Laura reached into her pocket and withdrew her badge. The weight of it was nothing, literally nothing, but it had represented something for 6 years. She set it on the desk with the same care she used for everything. Her voice, when she spoke, was completely level. I understand. 2 words. No argument. No explanation. No defense that could be offered because any defense would be a violation, because explaining where she learned the procedure would expose Captain Laura Bennett, and exposing Captain Laura Bennett violated direct orders given to her in a room at the Pentagon whose location she was still technically prohibited from identifying. She turned and walked toward the door, past Mercer, who was already putting his phone away, already texting someone about the successful conclusion of his operation. She didn't look at him. She didn't acknowledge his existence. She'd learned long ago that the people who needed the most acknowledgement from you were also the people who deserved the least, and she had important things to do now, like leaving this place without allowing her face to show what her hands wanted to do. The evening air outside Seattle General was cool and carried the smell of impending rain. Laura sat in her car for exactly 20 minutes before starting the engine, her hands completely steady on the steering wheel, her jaw clenched so tight that her teeth ached with the pressure of restraint. She had survived worse than this. She had held worse in her hands. But as she pulled out of the parking lot and pointed the car toward home, toward her empty apartment and the next 7 hours before her son woke up and asked why she wasn't at work, she reached into her pocket and withdrew the folded flag from her fallen teammate. The one from Ramadi. The one from a person who'd run out of luck one afternoon when luck was the only thing standing between alive and not alive. She gripped it until her knuckles went white, and then she drove home to wait for whatever came next. The folder hit Dr. Mercer's hands within an hour. Not a request for a meeting. Not a suggestion for review. Incident reports, stacked like evidence at a trial, each page bearing his own signature, each one another nail in the coffin he'd been building for months. He moved through the administration office with the confidence of a man who understood institutional power the way other men understood breathing: 3 calls to allies, 2 mentions of patient safety liability, 1 carefully worded insinuation that Laura's reckless behavior during Hayes's emergency had endangered not just one patient but the entire ICU's reputation. The folder was thick. 40 pages. Each one meticulously documented, each one false, each one designed to look like the careful work of a doctor protecting his hospital from a dangerous nurse. Practicing beyond scope. Unauthorized procedures. Endangering patient welfare through reckless action. The words sat on the pages like accusations cast in stone, backed by his position, his credentials, his medical degree hanging on the wall of his office like a shield that deflected accountability. He had fabricated a timeline showing that Laura had overstepped protocol before the emergency, not during it, showing a pattern rather than a moment of desperation. He had twisted her actions into negligence, her competence into insubordination, her decision to save a dying Marine into career-ending recklessness. By late afternoon, the folder had traveled through 3 administrative offices. By evening, security was at the ICU entrance. She saw them before they saw her. 2 guards in polo shirts with radios clipped to their belts, their faces carrying the particular discomfort of men asked to do something unpleasant. Laura was changing in 4-bag, normal Thursday work, routine Thursday motions, when the charge nurse touched her elbow with the gentleness of someone delivering a terminal diagnosis. The message came from HR. Laura needed to surrender her badge and accompany security to the office. Not a request. It was the tone that told her everything. She set down the 4-bag with the same care she'd used disarming a bomb, her hand steady, her face a mask that revealed nothing of the earthquake happening behind her ribs. The hallway was long. Fluorescent lights hummed their mechanical drone, and somewhere a monitor beeped its endless rhythm as she walked between the 2 guards. Nurses stopped mid-stride, watching. A resident looked away. The ICU staff parted like water around a stone, nobody making eye contact, nobody willing to associate with someone being escorted out by security. At the exit, Dr. Mercer stood holding his folder, 40 pages of lies bound in the satisfaction of a man who understood that institutional power moved faster than the truth. His face bore the expression of a chess player who had just achieved checkmate, and he was still holding his folder when Laura handed over her badge, the plastic rectangle clipping against the tile floor with a sound like something breaking. The ID badge that had taken 7 years to earn left a small scratch on the ground. Mercer watched it with the expression of a man watching his enemy surrender unconditionally. She drove home. The car was quiet except for the hiss of air from the vents, which suddenly sounded like the sound a life makes when it stops, and she had to pull over twice because her vision kept swimming. But she didn't cry. Not yet. Not in the car where anyone could see. She waited until she was home, until the front door was closed, until nobody could witness the moment the composure cracked like ice under weight. Tuesday at noon, her hands gripped the folded flag from a teammate who'd run out of luck one afternoon in Ramadi when luck was the only thing standing between alive and not alive. Her knuckles went white holding it. The kitchen table became an island, and she was drowning on it. Her shoulders moved, but no sound came out, the kind of crying that belongs to people who'd learned to weep silently so their children wouldn't hear them break. 12 years of commendations meant nothing. 3 tours of service meant nothing. 2 Purple Hearts folded into a cedar chest upstairs meant nothing. The Pentagon had erased her records after the operation went sideways, had told Captain Laura Bennett that she was dead to the government, that she needed to disappear into civilian life and never surface, never speak of Ramadi, never let anyone know that the quiet nurse in Norfolk was actually a combat surgeon who'd held the line when everything else collapsed. She couldn't fight back. She couldn't explain. She couldn't defend herself without admitting she was someone the Pentagon had ordered to forget herself. The door opened at 3:22 p.m. Her son stood in the doorway, backpack still on his shoulders, confusion written across his 12-year-old face like a language she didn't know how to translate. "Mom." His voice was small. "Why are you home?" She lifted her face, wiped it with the back of her hand, and felt the weight of every secret she'd carried pressing down like a physical thing. Just a schedule change, baby. Just a schedule change. But he wasn't stupid. He was her son. He saw the red eyes, the way her shoulders curved inward like a wounded animal trying to protect itself, the complete absence of the composure that usually held his mother together like a steel frame holding up a building. He set down his backpack and sat next to her at the table without asking permission, the way children do when they sense that an adult has reached the bottom of something and needs witnessing. She held the folded flag between them, and neither of them spoke, and the silence in the kitchen was the silence of people who understood that some damage runs deeper than words could reach. Meanwhile, in the ICU at Seattle General, Commander Hayes was crashing again. The infection wasn't fully cleared. His vitals had started to deteriorate the moment Laura left, the moment a different nurse took over his case, the moment the aggressive antibiotic protocol that Laura had charted got replaced with something more conservative, more by the book, more in line with what Dr. Mercer ordered. Hayes's wife kept asking for Laura. She asked the charge nurse. She asked the residents. She asked anyone with a badge and a radio. Where's Laura? She understands his case. She knows what he needs. The staff looked at each other and said nothing, because saying something meant admitting that they'd watched a competent nurse get destroyed and had done nothing to stop it. By that evening, Hayes's temperature was climbing again. His wife called Laura's cell in desperation, her voice carrying the particular panic of someone watching their husband deteriorate in real time. They won't tell me where you are. Marcus is getting worse. He keeps asking for you. His fever is back up, and they're not doing anything, they're just watching him decline. Laura sat in her car in the parking lot of Seattle General at 6:52 p.m. She still had visitor credentials from before. She could walk in as a family member, not staff. The ICU doors would open for her. Nobody would stop a visitor. She walked into Hayes's room as the evening shift was changing over, the overlap moment when the hallways blurred with movement and nobody was watching anything too carefully. Hayes's condition was obvious immediately, the slow, methodical decline of someone being neglected by the system designed to save him. The chest tube drainage had changed color. His temperature read 39.6 degrees. Mercer had scaled back the aggressive antibiotic protocol to something that looked appropriate on paper but did nothing in reality. She locked the door behind her. The sound of the lock engaging was small but absolute, and it echoed through the hallway outside. Through the window in the door, Mercer appeared like a demon summoned, his face transforming from routine authority to furious shock. He started hammering. "Unlock this door immediately. This is a violation of hospital protocol. I'm calling security." Laura didn't hear him. Her hands had already moved into the space where Captain Bennett lived, the version of herself who'd held the line in Ramadi when everything else was collapsing. She adjusted the antibiotic rates, pushing doses that Mercer had deliberately reduced. She repositioned the chest tube, which had migrated slightly and was draining inefficiently. She performed aggressive wound debridement, her movements precise as a surgical laser, her mind running the combat medicine calculations that had saved 11 lives in a schoolhouse with mortar rounds landing outside and generators failing one by one. For 40 minutes she worked while Mercer pounded on the door, threatening arrest, threatening lawsuits, threatening everything he could threaten. The ICU staff gathered outside but nobody moved to override the lock. Somewhere in the building, security was being called. Somewhere in the building, people were understanding what was happening, that a nurse had locked the door and was working with the kind of authority and precision that belonged to someone who had trained for scenarios far worse than a hospital protocol violation. Hayes stabilized. His fever broke within 22 minutes of the antibiotic adjustment. His oxygen saturation climbed. His vital signs, which had been sliding toward cardiac arrest, reversed course and started moving toward normal. Only then did Laura unlock the door, her face composed, her movements deliberate, her voice steady as she addressed the cluster of security guards waiting outside. "He's stable now. Call his wife. Tell her he's improving." She walked past them with her head high, and nobody moved to stop her. It wasn't a request. It was a command delivered by someone whose authority existed on a level that hospital policy couldn't touch. 3 days later, a federal transport van pulled into the secured loading bay at Seattle General. The Iraqi national lay on a stretcher, his abdomen wrapped in fresh bandages, federal agents flanking him like stone sentries in dark suits. They wheeled him to the ICU's isolated wing, the one reserved for detainees in government custody. The Marines posted outside his room wore the 1,000-yard stare of soldiers who'd seen the worst and decided to guard it anyway. Laura was in the hallway wearing visitor credentials clipped to a borrowed cardigan, returning from Commander Hayes's room where she'd checked his vitals without touching the chart. She moved past the detainee's door, and the man's eyes found her. Not the nurse in scrubs. Not the woman pushing an forced stand. His pupils dilated with something beyond pain, beyond recognition. Something like seeing a ghost walk through walls. His whisper cut through the mechanical hum of the ventilator like a knife through canvas. Malak Ulsara. Angel of the desert. His hand trembled against the bed rail, not from fever but from something that lived deeper, the kind of tremor that came from remembering what it felt like to be dying in a schoolhouse 200 miles from anywhere, watching a woman in blood-soaked uniform work 17 surgical cases with generators that died every 90 minutes and mortar rounds that sounded like God clearing his throat. The Marine Guard's radio crackled. Within 40 seconds, a captain from the liaison office was moving fast, pulling files, his face a mask of controlled urgency. He appeared at Laura's shoulder without preamble, his voice low and urgent. "Captain Bennett. We need to talk. Now." It wasn't a question. The way he said her rank, not her name, her rank, meant the entire structure of her disappearance had just collapsed like a house built on classified air. He pulled a thick file from his duty bag and began reading aloud, his words precise as rifle fire. The citation described a 19-year-old captain holding a concrete schoolhouse alone for 16 hours while enemy fire came from 3 angles. No backup. No medevac possible. The runway was gone, cratered by IEDs and controlled by people who wanted her dead. She operated on 11 separate Marines and a handful of civilians, hands steady as surgical lasers, rationing morphine to milligrams, amputating a limb without proper lighting because the backup generator had failed at hour 8. The citation mentioned her voice never wavered. It mentioned Marines who said she was the calmest human being they'd ever seen while the world burned outside the windows. The door to the detainee's room burst open. Dr. Mercer came through it like a man whose last thread of control had finally snapped. His face was the color of old concrete, his voice a blade. "Get her out. Get her out of this hospital. Now star. I don't care if." The 2-star general who'd flown in from Quantico the night before stepped into the hallway from the elevator bank, his uniform pressed like a threat. His presence changed the air pressure. The Marines straightened simultaneously. Mercer's words died mid-sentence, his mouth moving soundlessly like a fish on dry concrete. The general's eyes found Laura, and he rendered a salute, the kind of crisp, formal gesture that acknowledged rank earned under fire. His hand came down from his brow with military precision. "Captain Bennett. I've read your file. 16 hours in Ramadi. 11 successful cases under siege conditions." He paused, then continued with the measured cadence of someone reading history. "Bronze Star for Valor." Another pause as the weight of each decoration settled into the hallway's fluorescent silence. "Silver Star for extraordinary heroism during Operation Phantom Fury." Mercer's face had gone from concrete gray to something closer to ash. 2 Purple Hearts. The general's voice never wavered. "And a Navy Cross for performing emergency thoracotomy under fire with no backup surgical team, no anesthesia beyond morphine, and a backup generator that had failed 3 hours prior. Those surgeries kept 11 men alive long enough to reach definitive care. 11 men went home because you didn't stop working." A Pentagon courier appeared at the stairwell door, moving with the precision of someone who worked in rooms where secrets lived and died. She carried a classified folder, the kind with restricted access stamps and a code name printed across the cover in letters that made hospital staff go pale. She handed it directly to the general, who opened it and turned it so the Marine liaison could read the confirmation of Laura's identity, the one that had been erased from every official record, buried under classification levels that made her service retroactively invisible. Mercer's hands had begun to shake. Not tremor. Not fear. Rage so pure it had turned him into a seizing animal. His mouth worked soundlessly. Then, this changes nothing. She still violated protocol. She still, the general said with the kind of calm that comes from having already made decisions, saved your patient's life when you were frozen in his doorway like a scared child. She still locked that door and kept working while you were outside screaming about policy. And she did it while banned from practicing, while under disciplinary review, while you had already begun the process of destroying her career with forged documentation. The silence lasted exactly 3 seconds. Then the Marine liaison's radio crackled with an update that made his jaw tighten. The FBI had arrived at Seattle General 40 minutes ago. They were in Mercer's office with a warrant and a list of dates spanning 2 years. His patient records were flagged. His digital access logs showed timestamps that didn't match his written notes. Files edited after the fact. Medication timelines altered. Surgical complications attributed to nursing staff that existed only in his documentation, paperwork that contradicted the actual medical devices, actual monitor printouts, actual bedside notes taken by residents and nurses who'd been there. The agents moved through the hospital like a controlled collapse. They found 6 cases where Mercer had covered his own surgical errors by blaming nurses. 17 formal complaints he'd buried through falsified paperwork. 9 staff members he'd driven out with manufactured disciplinary actions. Each forged document a federal crime because Seattle General received Medicare funding. Each altered timestamp became obstruction of justice. The scope expanded like an infection until it consumed everything he'd built on lies and institutional contempt. By evening, the same hallway where Mercer had humiliated Laura in front of Commander Hayes' family became the stage for his reckoning. 2 FBI agents walked straight to him during evening rounds, their badges catching the fluorescent light like mirrors reflecting truth back at liars. The words were formal, practiced, delivered without mercy, falsifying federal medical records, healthcare fraud, obstruction of justice, conspiracy to deprive a federal witness of her civil rights. The charges stacked like bodies. The handcuffs clicked around his wrists with a sound that belonged in a different story, one where the villain finally understood the machinery he'd taken for granted. His colleagues turned away. The residents he'd bullied stepped back. The nurses he'd blamed provided statements with surgical precision, describing dates and times, quoted insults, documented humiliations, all of it preserved in the kind of careful record-keeping that made courtrooms listen. Mercer was walked past staff and patients and families, past the waiting room where the Hayes family had sat holding each other, past the ICU doors where he'd once held absolute authority over people's lives through paperwork and intimidation. Cameras flashed like artillery. His face showed pure horror as the federal vehicle pulled away, his medical license suspended pending revocation, his freedom ending in a vehicle that smelled like 1,000 other failures transported to federal prisons where credentials meant nothing. Laura watched from a 4th-floor window, her face composed, her hands steady as they rested against the cold glass. She felt nothing but empty vindication, the kind of relief that comes when a wound finally stops bleeding because the infection has been removed entirely. 2 months later, she stood in her navy dress blues at the Medal of Honor ceremony, a uniform pressed with the precision of someone who'd worn it in places that demanded perfection. The gymnasium at Norfolk Naval Station was packed with military personnel, hospital staff, journalists, and families. Commander Hayes sat in the front row, finally walking with a cane instead of a wheelchair, his wife beside him with her hand on his arm. Her son was there, finally understanding why his mother had come home crying, why she couldn't fight back, why she'd locked that door and kept working while the world tried to destroy her. The general pinned the medals to her chest one at a time, decorations that had been classified when earned, now public, finally acknowledged. The Navy Cross caught the stage lights like captured starlight. Her personnel records were restored. Seattle General had offered her the Director of Critical Care position, along with a formal apology delivered by a hospital administrator who'd finally read the classified file. The institution that had tried to crush her was now reorganizing itself around her expertise. Across the city, in a very different geography, Dr. Mercer loaded boxes into a medical supply van wearing a federal prison work release vest. His sentence was 5 years. His medical license was permanently revoked. He would spend his days driving supplies through the same hospital system where he'd once wielded power through paperwork and contempt, invisible now, just another worker pushing equipment from loading dock to supply room, the same way he'd once tried to make Laura invisible. Except this time, the invisibility was consequence rather than camouflage. On Laura's desk in her new office sat 2 folded flags. One was the flag from her fallen teammate, the one she'd carried through years of hiding, gripped in her hands during the worst nights, pressed against her chest like evidence that her sacrifices had meaning. The other was new, her own service flag, finally displayed, no longer classified, no longer a secret that could destroy her. Both flags existed in the same careful frame, side by side, testifying to the cost of service. Commander Hayes visited 3 weeks after the ceremony, walking now without the cane, his chest still bearing the surgical scar that Laura's hands had closed with combat precision. He stood in her doorway with his daughter, who was maybe 12, her eyes wide as she took in the uniform, the medals, the 2 flags. "You saved my life twice," Hayes said. "Once in that room, and once in Ramadi. My whole platoon, I've been tracking down guys from 2006. They all remember you. The medic who wouldn't stop working. They called you Malik. Said you saved lives no human should have been able to save." Laura looked at the flags, at Hayes, at the life she could finally claim without destroying everything. Her son asked the question that mattered: why did you hide who you were? She sat down in her office chair, her hands folded on the desk, her voice steady as a held breath. Sometimes staying quiet is the mission. Until it isn't. Until the cost of silence becomes bigger than the cost of being seen. Until the people around you need to know what you actually are, not what they assume. The final beat showed her leading combat medicine training for incoming ICU staff, teaching the next generation of nurses what she'd learned in Ramadi, what she'd proven in Seattle General. Her voice cut through the training room with the authority of someone who'd earned it through impossible circumstances. The ones who have seen the worst often give the most. Subscribe for more stories about the ones who change everything quietly, and comment below: have you ever been underestimated by someone who had no idea who they were standing next to?